Welcome to the deep dive. Today we're going to be doing, cracking open a neurology study guide
Oh,
to explore the amazing world of human senses.
yeah.
Specifically, we'll be focusing on sight and hearing.
That's right. Think of it as a detective story.
Okay.
We use this study guide to understand not just how these senses work,
Right.
but what happens when they don't.
I love that analogy.
Uh-huh.
So ready to put on our detective hats and delve into the fascinating world of the eye.
Absolutely. Our guide starts with a diagram of the eye.
Yeah.
And it's packed with details.
Let's start with something I've always wondered about. I know the cornea is that clear outer layer,
Uh-huh.
but what makes it so important for vision?
Well, think of the cornea as the eye's window.
Okay.
It's not just about protection. It's the first point of contact for light
Right.
entering the eye. And get this.
Yeah.
It does about 2/3 of the focusing work before the light even hits the lens.
Wow, I had no idea it played such a big role. Okay,
Yeah.
so the light passes through the cornea, then what?
Then it hits the lens, which fine-tunes the focus, directing the light onto the retina at the back of the eye.
Okay.
The retina is like the eye's canvas, where light is converted into electrical signals the brain can understand.
And that's where those amazing photoreceptor cells,
Yes!
rods and cones come in, right?
Exactly. Cones allow us to see color, especially in bright light.
Mm-hmm.
Rods are the low-light specialists, letting us see in dim conditions. Here's a fun fact from the study guide.
Okay.
The density of rods actually increases as you move toward the periphery of the retina.
Really?
That's why if you're trying to see a faint star at night, you might actually see it better by looking slightly away from it.
That's wild. I'm definitely going to try that next time I'm stargazing, but our vision isn't always perfect, is it?
Right.
The guide mentions a bunch of things that can go wrong, like presbyopia.
Right. Presbyopia is that age-related vision change where the lens gets a little stiffer
Yeah.
and focusing on close-up objects becomes a challenge. The classic holding the menu at arm's length scenario.
Been there. It makes you appreciate the mechanics of vision, how a tiny change in the lens can have such a big impact.
Right.
Speaking of changes, the guide also mentions cataracts.
Cataracts cloud the lens, making vision blurry or hazy. It's another
Yeah.
common age-related change. Thankfully, cataract surgery is quite effective, replacing the cloudy lens with an artificial one.
That's reassuring, but vision problems aren't always age-related, right?
Right.
What about something like myopia or nearsightedness?
Myopia is a refractive error where the shape of the eye causes light to focus in front of the retina instead of directly on it. This makes distant objects appear blurry.
So it's not just that the lens isn't working right, it's the actual shape of the eye that's off the guide, or also mentions hyperopia or farsightedness.
That's the opposite of myopia and hyperopia. The eye is slightly shorter than normal, or the cornea is too flat, causing light to focus behind the retina. This makes close-up objects appear blurry.
It's fascinating how such subtle differences in the eye structure can have such noticeable effects on our vision. The guide even mentions astigmatism, which is caused by an irregularly shaped cornea or lens.
With astigmatism, light doesn't focus evenly on the retina, causing blurred vision at all distances.
Mhm.
Even slight curvatures can have a big impact.
It makes you realize the precision involved in creating clear vision. It's like a perfectly orchestrated symphony of light and structure, but things can go wrong in this delicate system. The guide mentions a condition called amblyopia, also known as lazy eye.
Amblyopia typically develops during childhood, often linked to strabismus, where the eyes are misaligned. The brain essentially starts favoring one eye over the other, and the weaker eye's vision doesn't develop properly.
That makes sense. The guide even mentions some pretty intense treatments for these eye conditions, like electrodiathermy and cryotherapy for retinal detachment. Can you explain what those are?
Sure, retinal detachment is when the retina separates from the back of the eye, and it can cause serious vision loss. Electrodiathermy uses heat to create scar tissue that helps reattach the retina. Cryotherapy does the same thing, but with extreme cold valor. Both are pretty amazing examples of how doctors can use targeted energy to repair the eye.
It's like tiny, precise welding inside the eye. Incredible. The guide also mentions glaucoma, which I know is a serious condition.
Glaucoma involves increased pressure inside the eye, which can damage the optic nerve. It often develops slowly, so people might not realize they have it until their vision is already affected.
That's scary, and it seems like there are a lot of other conditions that can affect the eye.
There are, but let's shift our focus now from vision to hearing and take a deep dive into the ear.
Okay, let's swap our magnifying glass for a stethoscope and explore the world of sound.
Our guide breaks down the ear into three main parts: the outer ear, the middle ear, and the inner ear.
I remember from biology class that the outer ear is all about funneling sound waves into the ear canal, but what happens next?
Well, those sound waves hit the eardrum, a thin membrane that vibrates like a drumhead. Those vibrations then travel to the middle ear, which houses three tiny bones, the malleus ischiticus and stapes.
Those are some serious names for such tiny bones.
They might be small, but they have a big job. They amplify the vibrations from the eardrum and pass them along to the inner ear. And speaking of the middle ear, let's not forget the eustachian tube. You know that feeling when your ears pop on a plane?
Oh, yeah.
That's your eustachian tube working to balance the pressure change between your middle ear and the outside world.
I always wondered about that. Okay, so the sound vibrations make their way to the inner ear. What happens there?
The inner ear houses the cochlea, a snail-shaped structure filled with fluid and tiny hair cells. When the sound vibrations reach the cochlea, they cause these hair cells to move, generating electrical signals that are sent to the brain.
So it's the hair cells that actually convert those vibrations into something our brain can interpret as sound. Amazing. But what about balance? I know the ear plays a role in that too.
You're right, the inner ear also contains structures called the semicircular canals, and the vestibule, which are responsible for our sense of balance and spatial orientation. They detect movement and changes in head position, helping us stay upright and coordinated.
It's incredible how much is going on in that tiny space. It seems like our ears are just as complex as our eyes and just as vulnerable to problems.
Absolutely. And the study guide goes into detail about some of these issues, starting with presbycusis, which is the age-related decline in hearing.
Ah, yes, presbycusis. My grandfather has that, and he always complains about missing parts of conversations.
It's incredibly common. You might notice it as difficulty hearing high-pitched sounds or understanding speech in noisy environments. But age isn't the only culprit when it comes to hearing problems. The guide also distinguishes between two main types of hearing loss: conductive and sensorineural.
Right, conductive hearing loss is when something blocks the sound waves from reaching the inner ear, like a buildup of earwax or an ear infection.
Exactly. But with sensorineural hearing loss, the problem lies in the inner ear itself, or the nerve that carries auditory information to the brain. This type of hearing loss can be caused by damage to the hair cells in the cochlea, exposure to loud noises, or even certain medical conditions.
So different causes, different locations of the problem. I'm curious about some of the specific conditions the guide mentions, like Meniere's disease, which sounds pretty awful.
Meniere's disease is a disorder of the inner ear that causes a classic triad of symptoms: tinnitus, which is ringing or buzzing in the ears; vertigo, that spinning sensation, and hearing loss.
The guide mentions a strict low-salt diet as part of the treatment for Meniere's. Why would salt impact a condition in the inner ear? That seems counterintuitive.
That's a great question. It has to do with fluid balance in the inner ear. Excess salt can cause fluid retention, which can increase pressure in the inner ear and exacerbate Meniere's symptoms. So reducing salt intake can help regulate that fluid balance and alleviate the symptoms.
That makes sense. What about otosclerosis?
Otosclerosis is a condition that affects the tiny bones in the middle ear. Abnormal bone growth interferes with their movement, leading to conductive hearing loss.
So it's like the amplification system in the middle ear isn't working properly.
Exactly. Thankfully, hearing aids or surgery can often help people with otosclerosis regain their hearing.
That's good to know. The guide also mentions acoustic neuroma, a slow-growing tumor that affects the vestibular nerve. That sounds pretty serious.
It can be, but thankfully it's usually benign. The vestibular nerve is involved in both hearing and balance, so acoustic neuroma can cause a range of symptoms, including hearing loss, dizziness, and tinnitus.
It's incredible how interconnected our senses are and how a problem in one part of the ear can affect both hearing and balance.
That's right, and it highlights how important it is to take care of our sensory systems.
Absolutely. So we've explored the intricacies of sight and hearing, the fascinating structures involved and some of the things that can go wrong, but our exploration of the senses isn't over yet, is it? The guide also touches on some broader concepts like sensory deficit, sensory overload, and sensory deprivation.
Right, these concepts take us beyond the individual senses and delve into how our overall sensory experience shapes our interaction with the world, ready to expand our investigation.
Absolutely. Let's see where this deep dive takes us next. Okay, so we've journeyed through the anatomy of our eyes and ears and uncovered some of the mysteries behind how they work. Now, I'm really curious to explore these broader concepts of sensory deficit, sensory overload, and sensory deprivation. What can our neurology study guide tell us about these experiences?
Well, these concepts really highlight how our senses are constantly working to strike a delicate balance. Sensory deficit, as our guide defines it, is the partial or complete loss of one or more senses.
Yeah, it makes you realize how much we rely on our senses to navigate the world. Imagine losing your sense of taste or touch. It would fundamentally change how you experience everyday life.
Absolutely. And sensory overload is like the flip side of that coin.
Yeah.
Is what happens when we're bombarded with too much sensory input and our brains struggle to process it all.
I think we've all experienced that feeling of being overwhelmed in a crowded, noisy environment. Too many sights, sounds, smells, it can be incredibly disorienting.
Exactly. And it's not just about the quantity of input, it's also about the quality. Think about flickering fluorescent lights or the constant hum of traffic. Those kinds of sensory experiences can be particularly jarring and difficult to tune out.
It's like our sensory circuits are overloaded and we need to find a way to escape the noise.
That's a great way to put it. And then there's sensory deprivation, which involves a significant reduction in sensory input. While it might sound unpleasant, it can actually be quite therapeutic.
I've heard about those flotation tanks where you're suspended in darkness and silence. Is that a form of sensory deprivation?
It is flotation tanks are designed to minimize external stimuli, allowing the brain to relax and enter a state of deep calm. Some people find it incredibly restorative, like a mental reset button.
I can see how that would be appealing in our hyperstimulating world. It's interesting to think about how manipulating sensory input can have such profound effects on our well-being.
It really does speak to the plasticity of our brains and our ability to adapt to different sensory environments. But let's circle back to some of the specific conditions we were discussing earlier.
Yeah.
I'd like to delve a little deeper into glaucoma, which the guide highlights as a serious concern.
Yeah, you mentioned that glaucoma involves increased pressure inside the eye, which can damage the optic nerve. Can you explain how that pressure buildup happens?
Sure, the eye is filled with a fluid called aqueous humor, which is constantly being produced and drained in glaucoma. The drainage system doesn't work properly, causing the fluid to accumulate and increase pressure within the eye.
So it's like a plumbing issue inside the eye. The guide mentions two main types of glaucoma, open angle and closed angle. What's the difference?
Open-angle glaucoma is the most common type. The drainage angle where the fluid normally exits is open, but the drainage system itself is still not functioning properly. This type of glaucoma tends to develop slowly, and people often don't notice any symptoms until their vision is significantly affected.
That's why it's sometimes called the silent thief of sight.
Yeah.
Exactly. Closed angle glaucoma, on the other hand, is less common, but can be much more sudden and painful. It occurs when the iris blocks the drainage angle, completely causing a rapid buildup of pressure. This is a medical emergency and requires immediate treatment.
The guide mentions a medication called pilocarpine, which is used to treat glaucoma. How does that work?
Pilocarpine helps to improve fluid drainage by constricting the pupil and opening up the drainage angle. It's often used in conjunction with other medications that reduce the production of aqueous humor.
It's amazing how medical science has developed these targeted treatments for such specific issues within the eye. The guide also mentions a surgical procedure called iridectomy for glaucoma.
That's right. An iridectomy involves creating a small hole in the iris to bypass the blocked drainage angle and allow fluid to escape. It's a pretty remarkable procedure.
It is another condition the guide highlights as retinal detachment, which sounds quite alarming. It can be retinal detachment occurs when the retina, which is the light-sensitive layer at the back of the eye, separates from the underlying tissue. It can be caused by trauma to the eye, but sometimes it happens spontaneously, especially in people with certain eye conditions.
The guide mentions symptoms like flashes of light floaters and a shadow or curtain across the field of vision.
Those are all red flags that warrant immediate medical attention.
Retinal detachment is a serious condition that can lead to permanent vision loss if not treated promptly.
What are the treatment options?
Well, depending on the severity, the detachment treatment can range from laser surgery or cryotherapy to more complex procedures like a scleral buckle, which involves placing a band around the eye to help reattach the retina.
It's like a tiny construction project happening inside the eye.
You could say that. The guide also lists a number of other eye conditions, including keratitis, which is inflammation of the cornea.
Keratitis can be caused by a variety of things, right? Like infections, injuries, or even allergies. That's right. And then there are styes, those painful little bumps that form on the eyelid. They're basically infections of the oil glands in the eyelid.
And chalazions are similar, right?
Yes, chalazions are also bumps on the eyelid, but they're usually painless and develop more slowly. They're caused by blocked oil glands rather than infections.
So both involve the oil glands, but styes are more acute and painful, while chalazions are more chronic and less bothersome. What about conjunctivitis?
Conjunctivitis, or pink eye, is an inflammation of the conjunctiva, the thin membrane that lines the inside of the eyelid and covers the white part of the eye. It can be caused by viruses, bacteria, or allergens.
And it's highly contagious, right? I remember having to stay home from school when I had pink eye as a kid.
Yes, especially the viral and bacterial forms. That's why the guide emphasizes the importance of good hand hygiene to prevent its spread, another condition. The guide mentions is macular degeneration, which affects central vision.
I know that macular degeneration is a leading cause of vision loss in older adults. Can you explain why it affects central vision specifically?
The macula is a small area in the center of the retina that's responsible for sharp, detailed vision. It's what allows us to see faces clearly, read, and drive in macular degeneration. The cells in the macula break down, leading to distorted central vision or even blind spots.
It sounds incredibly debilitating.
It can be, and unfortunately there's no cure for the most common form of macular degeneration, called age-related macular degeneration, although there are treatments that can help slow its progression.
The guide also mentions diabetic retinopathy, which I know is a complication of diabetes.
That's right. Diabetic retinopathy occurs when high blood sugar levels damage blood vessels in the retina. This can lead to fluid leakage, bleeding, and even the formation of new abnormal blood vessels.
And that can ultimately lead to vision loss, right?
Unfortunately, yes, that's why it's crucial for people with diabetes to manage their blood sugar levels carefully and get regular eye exams.
Early detection and treatment are key for so many of these eye conditions. It's incredible how many different things can affect our vision.
It really is, and it highlights the importance of protecting our eyesight and seeking prompt medical attention if we notice any changes in our vision.
Absolutely. We've covered a lot of ground in our exploration of the senses. What stands out to you the most, dear listener?
And how has this deep dive changed your perspective on the fascinating and intricate world of sight and hearing?
We'll continue our exploration in the final part of our deep dive, where we'll delve deeper into the intriguing concepts of sensory deficit, sensory overload, and sensory deprivation. So we've spent quite a bit of time exploring, all the amazing complexities of sight and hearing,
Uh-huh.
and it's clear that these senses are vital for navigating the world. But I'm intrigued by these broader concepts of sensory deficit, sensory overload, and sensory deprivation.
Hmm.
These ideas seem to touch on how our sensory experiences shape our understanding of reality.
That's a fascinating observation.
Yeah.
And you're right, these concepts really push us to think beyond the individual senses and consider the overall sensory landscape.
Okay.
Let's start with sensory deficit,
Yeah.
which our study guide defines as the partial or complete loss of one or more senses.
I imagine losing any of our senses would be a challenging experience, but some deficits seem particularly difficult to adapt to.
That's a good point.
Hmm.
The impact of a sensory deficit depends on a lot of factors, including which sense is affected,
Mm-hmm.
the severity of the loss, and the individual's ability to compensate using other senses.
Right.
For example, someone with vision loss might develop heightened senses of hearing and touch to navigate their surroundings.
That makes sense. Our brains are incredibly adaptable, finding ways to compensate for lost sensory input. What about sensory overload?
Yeah.
We touched on this earlier, but I'm curious to explore it further.
Sensory overload occurs when we're bombarded with an excessive amount of sensory input, overwhelming our ability to process it all.
Right.
This can lead to feelings of anxiety, stress, and even physical discomfort.
I know I've experienced this in crowded, noisy environments where the sheer volume of sights and sounds can be incredibly overwhelming.
Right? Those are classic examples. But sensory overload isn't just about quantity.
Mm-hmm.
It's also about the quality of the sensory input.
Okay.
Think about flickering lights, jarring noises, or strong smells. These types of stimuli can be particularly difficult for our brains to filter out, leading to heightened sensitivity and discomfort.
So it's not just about being in a busy environment, it's about the specific types of sensory input we're exposed to. It seems like our modern world, with its constant bombardment of information and stimulation, is practically designed to trigger sensory overload.
You could say that our always-on, digitally connected lives definitely contribute to sensory overload.
Right.
Think about the constant notifications, the flashing screens, the endless stream of information.
That's a lot.
It's a lot for our brains to process.
Yeah. It makes me wonder if sensory overload is becoming more common as our lives become increasingly digitized and hyperstimulated.
That's an interesting question, and one that researchers are exploring. It's certainly plausible that our modern lifestyles are contributing to a rise in sensory sensitivities and overload.
Yeah, it makes the idea of sensory deprivation even more appealing,
Right.
in a way to find a space of quiet and stillness amidst all the noise.
Exactly. Sensory deprivation involves a significant reduction in sensory input, creating a calming, almost meditative experience.
Yeah.
Flotation tanks are a great example of this.
hmm
By minimizing external stimuli, they allow the brain to relax and reset.
Some people might find the idea of sensory deprivation a bit daunting. Being in complete darkness and silence could feel unsettling. But I've heard that flotation tanks can be incredibly therapeutic, helping to reduce stress, anxiety, and even chronic pain.
That's right. There's a growing body of research suggesting that sensory deprivation can have a range of positive effects, both physically and mentally.
Okay.
By reducing sensory input, flotation tanks can help to calm the nervous system,
Mm.
promote relaxation, and
Uh-huh.
even enhance creativity and focus.
It's like giving your brain a much needed vacation from the constant barrage of information it's bombarded with on a daily basis.
I like that analogy. And it highlights the importance of finding ways to create balance in our sensory lives.
Right.
We need time for both stimulation and quiet for engagement and reflection.
Mm.
Our senses are powerful tools for experiencing the world, but it's up to us to use them wisely.
That's a great point. We need to be mindful of our sensory experiences and find ways to create environments that support our well-being.
Right.
This deep dive has been a fascinating journey through the world of the senses. I'm definitely walking away with a greater appreciation for the complexity and wonder of sight and hearing,
Me too.
and a heightened awareness of how our senses shape our experience of reality.
It's been a pleasure exploring these topics with you.
Likewise.
And to our listener, we encourage you to continue this exploration. Pay attention to your senses, notice how they interact with the world around you, and find ways to create a sensory landscape that supports your well-being.
That's a great takeaway. Until next time, dear listener, keep exploring, keep questioning, and keep diving deep.